sir? Myocardial attack. What is it? Yeah. I just saw your mouth open. I wasn't sure exactly what came up before. Myocardial infarction. So I think it's a heart attack. So if you talk to an older person, if they have chest pain, the first thing they'll do is deny that it's a heart attack, and the second thing they'll do is probably gas or acid reflux or some type of heartburn. So what's going to help with determining whether it's one or the other is taking your history, how old they are, what they've been doing, what they ate. If by chance they complain of something over here and it's an elderly person and they have a history in their family, they have a history of lifestyle habits that can contribute to cardiovascular disease, then you might want to refer right away. If it's somebody younger, then more likely than not, it's probably dyspepsia. In which case, antacids, find out when they ate last, maybe that had something to do with it. Find out what they ate, that might have something to do with it as well. For our purposes, we really can't do much other than that, but counsel. Okay. If it truly is dyspepsia, we just can counsel them, but there's not much else we can do. Any other questions about abdominal issues? Good. Okay, so there's we can go into 4 groups of 3. We'll do one scenario, and then we'll talk about pelvis. We'll do another scenario, and then if we have more time to do more scenarios, we'll combine stuff from last week, so thorax and abdomen and pelvis together, and then it could be any one of the conditions we talked about this week or last week. So here's the plan. Groups of 3. You can divide yourselves up into whatever groups you want, but we need 4 people outside. The gloves are by the door. We only have 3 kits, so I'll try to make up another station with the stuff that you need for that particular scenario. Okay. So you have 2 minutes to figure out who your groups are and to get 1 person outside.
Sorry, I'll go first.
Cool shoes.
That's right.
Jeff,
you're just like, there's probably off, but
oh yeah.
You know this machine broke down for a bit yesterday? Ken's got hers, but I didn't get mine.
And you handed it in when you got What do you think? What do you like to do?
what do you want?
Oh, perfect. I like to do
Oh yeah.
See? Communication.
Perfect group.
Two more.
Your gloves.
Oh, that song. Actually, dude.
John has to call and tell him yeah. They know about us in the ring. So I was going to go back see if I grab it today. I can't. My favorite practice.
Bus drive.
Yeah.
So appendix and
One of my guys had a bunch of visceral work done the day before we left for a trip. Just looked like Saturday on the Friday, he was just, oh man, he was in agony. Every time I asked him, my liver.
What was the problem?
He's just basically the certified said he woke up his liver and just started processing stuff that he hadn't processed in years.
Woke up his liver.
Well, yeah.
She just get tattoos.
One's an osteopath, a bunch of visceral plastic.
Just get the olives.
Oh, good.
Yeah, I got one.
We
So, medical alert, whatever you want, and whatever you want. Whatever you
you
want.
want multiple medical
Okay.
notification?
Okay. Let us
Sorry,
do.
hey, door's not closed. Cheater.
Let's do appendicitis. So for them to determine that it's appendicitis, you guys are conscious, or how about this? Why don't we do, you guys are unconscious for whatever reason. So they'll do this, because they don't know what happened. Okay, so the patient is going to be unconscious. When they start their vitals, before they, like right when they're starting their vitals, just wake up. When you wake up, they will ask you some questions, or they should start asking you some questions. And so we should lead them in the direction of appendicitis. So let's say you've been sick, and it hurts down here. You don't have to be specific, let's say it hurts down here. And then they'll have to palpate. So what the expectation is, as soon as they've done their history, so what happened, not really too sure, you've been sick, where does it hurt? Down there, they should get PT or RST. Because it's not trauma related, they should go into sample, okay? And get this information before doing anything. Once they've gotten all this information, because you've pointed to an area, what should they do next? Before palpate, ops. Look first. Okay, so expose, palpate, and say, oh, that kind of hurts, but right when they get on that one spot, which they should landmark appropriately because we just talked about that, then you can tell them it's like a 10 or 11 out of whatever, 10. 10 out of 10. No, right on palpation. Okay, so it's painful right on palpation, but they don't see anything. Okay. Once they've done that, they can either call EMS here, or they can call EMS right when they figure out that it's an appendix issue. Okay. Once they've done this part, they just continue with their process, finish off vitals, then do a thorough head to toe. And then the snare is over after the head to toe. Okay. So what we're looking for is to make sure that their history taking is pretty specific, that they observe, and they palpate right in the right spot. Okay. Now, what else should they palpate just to make sure it's not other things? The other quadrants. Okay. And when they do that, so they can do it here, or they can do it here, but they have to do it at some point. What's ideal? The first time. They're there already. If they palpate into the other areas, it's not painful, but what might they feel? Rigidity. So wherever the patient is. Okay.
So even when we're unconscious and they feel the quadrants, if they feel the quadrants, we don't wake up yet?
No. So good question. Over here, when they do a bleed and squeeze, if they go into the quadrants, you're just flexing. Okay, because there's rigidity.
If they say like, I don't feel anything rigid, should I?
So ideally, if they're doing it right, you shouldn't have to say anything. They should just say, oh, it feels rigid. Okay, again, they should trust their palpation skills. Well, the gym's right there. So for the patients, if you need to do a few sit-ups right now, do some sit-ups.
I actually read that. It's like do 8 minutes of abs before you go to the beach.
It works. No, don't fool. There are people that actually do that when they come in.
Oh no.
Yeah.
I've been to a bar before, and I go to the bathroom, and guys are doing chin-ups. Well, that's tall as I'm like,
You gotta look, Jack.
I know. Anyhow, okay, let's focus. Okay, so are you guys okay with with how to give the information? So don't wake up. Flex if they palpate. When they start this, if it seems like they're starting this, then just wake up. They should do a good thorough history, expose, palpate McBurney's, and then finish off with vitals. Give them shocky symptoms. At the very latest, they should call EMS after the vitals because now you're in shock.
So not shocky in a primary state.
If they report it feels strong and regular, you can give them week and thread. Okay, but again, you can only say it if they say it first. And that's the evaluator, that's not the patient. Okay. And then head to toe, hopefully they'll find the medical. Sound good? Okay, there's 4 stations. I'll be back in a minute after I talk to those guys.